If you're walking and you feel like your body's out of balance, or you've been told by the doctor that you have one leg that's longer than the other, then this video is for you. We're gonna talk about exactly what's happening. We call it a leg length discrepancy. So we hear it all the time. So people feel like they have a long leg or they're having pain, and we call it a functional short leg or a functional long leg. We all have a little bit of imbalance in our body. My left foot is longer than my right foot. It's not something that you should feel on a daily basis. So we're gonna dive into that today. We're gonna give you action steps and how you can fix it, but we're also gonna tell you exactly what's going on. Let's get right into the video. Our first exercise is the dying bug. So we call it a dying bug because you got to move a little bit so it's not a dead bug. People call it a dead bug. We're very specific on how we do this exercise, and we need to do both sides because we don't know which side is having a bigger problem. They actually have to work together. When we fix this from home, we're rebalancing these muscles, and muscles work in a system. So what I'm gonna do is I'm gonna lift my right leg up, and my left leg, I'm gonna push down almost like I'm lifting my hip up, but I don't want to lift it up. I just want to engage these muscles. So I'm going to push down through my heel right here, and then I'm going to resist with my hand and use the muscles in my leg to push against my hand. So I keep my head down and maintain this position. So I'm engaging, pushing through my heel, and I'm pushing through my leg, resisting with my hand, and I'm holding it for 10 seconds. And then I'm going to rest, switch positions. I'm gonna do the same thing right here. I'm gonna push down, engaging my glute. Your butt can come up a little bit. We can lift it up a little bit. We just don't wanna come really high. One major thing that I want you to watch out for, especially if you're having any low back pain or hip pain with your leg length problem, is that when we push up, that a lot of times we'll have clients, they push up and they push with their lower back. So now I'm engaging my back muscles instead of engaging primarily my glutes. So I'm pushing down, squeezing, engaging my glute, and then I'm pushing with this. You can use one hand or both hands. I'm resisting with my hands, and I'm holding this for 10 seconds. I just want to breathe through it. So I'm really focusing on pushing with this glute, pushing with my hip flexors, maintaining that position for 10 seconds, and I'm going to switch again, maintaining for 10 seconds. And I'm switching. It's crazy how difficult these exercises can be. When we're doing them correctly, they actually get kind of hard. So I'm holding that position. I'm engaging these muscles. So I'm getting an X pattern. I'm crossing my body right there. I want to do 3 sets of 10-second holds. It's going to take you less than 2 minutes. We just got to get set up in the right position and know which muscles we're engaging. We're engaging our hip flexors and our glutes, and that's where we want to feel it. We don't want to feel it in our lower back. Your abdomen, your muscles in your abs are going to work a little bit, but that shouldn't be our primary focus. Our primary focus is those hip flexors. Let's get into the second exercise. Our second exercise we're gonna work on is a bird dog. And so what we're gonna do is I wanna get core work at the same time, but we have some specific differences with this when we're fixing a leg length problem. So what I wanna do is I want my hand outside my shoulder on each side, and then I want my knees just slightly outside my hips. The reason that I want that is if I'm close together, it becomes very difficult to balance. So I want to keep this outside, and I want to think about my belly button like I have a laser pointer in my belly button. This exercise, a bird dog, is really easy for people when we're allowing ourselves to shift around, if we're not thinking about where our belly button's going. Also, people tend to tweak their back when they do this exercise because it's not done correctly. Nobody tells them exactly how to do it. So when I'm kicking back, I don't want to use my low back doing this. That's going to cause me more problems. If you're having low back pain, hip pain, knee pain, we want to stabilize our hips and our pelvis. We want our core and our hips working together. Remember that the core of the body is not just the abdomen. It's the abdomen, it's our hips and pelvis, and it's our thoracic spine and shoulder blades and lats. All this working together. So I want to, anytime I'm doing a bird dog, I want my hands just outside my shoulder, my knees just outside my hips, and I want to think about that laser pointer in my belly button shooting straight down. And then so if I'm just doing the bird dog portion, I'm slowly coming out, and I just tap my foot, squeeze my glute. And so I'm not using my lower back muscles, and I'm shifting to the other side, trying to stay directly in the middle. It's easy for me to allow my belly button to move around. If I stay directly in the middle, I'm gonna start to shake, and I can't breathe at the same time because I don't do this exercise enough. So now the extra piece that we want to focus on when we do this is that I want to get my lat engaged at the same time as I'm using my left glute. So I'm going to get into my bird dog position right here. I got my laser pointer and the belly button stays directly in the middle. I'm going to kick my leg back, squeezing that back glute, and then I'm going to do a pull, and I'm pulling my elbow down, trying to put it in my pocket right here. And I'm staying directly in the middle, controlling my breath. So I'm getting my, squeezing my glute, left glute, squeezing my lat. And so I'm doing a set of 10, and then I would just switch, trying to stay directly in the middle, engage, get that right leg up, squeeze the right glute, and then I'm pulling, putting my elbow in my back pocket right here. And what I'm getting right there is I'm getting the muscle on the backside on my glute. It crosses the thoracolumbar fascia and comes up to the lat that wraps underneath. So my left side coming down my back to my right glute, and then we're working my right lat coming down to my left glute. That X pattern is going to help me when I'm walking to keep me balanced. So I'm gliding properly so that I don't get out of alignment in that pelvis, and I don't continue to have this uneven feeling when I'm walking, because it wreaks havoc on our body. If we don't have a stable base through our pelvis, it doesn't matter what we do, how many core exercises you do. We need a stable base. If you cut somebody in half, the middle of their body is right through their pelvis the majority of the time. It's not through the abdomen. So the abs are important, but it's 80-20 rule. 80% is what's happening at the hips and the pelvis. 20% is what's happening at the abs. If you found this video helpful, like, comment, and follow us for more videos on exactly how we fix these problems in the clinic. So how can one leg be shorter or longer than the other? And how does it just all of a sudden happen? Now, we've had clients that have come in that had a hip replacement or a knee replacement, and they feel like they have a longer leg or a shorter leg. But if you haven't had that, or you have had that, it typically comes from a central point right here. It's called our SI joint. So the SI joint is the bottom of the spine, the sacrum coming down, and then this is the ilium. So that makes up the pelvis. We can get different rotations. We can have an up slip or a down slip. Let me go and explain that a little bit better. So right here, this SI joint, this is a smooth surface. Most of our joints right here in the back, when somebody says your joints are out of alignment, it's very difficult to get a joint in your spine out of alignment because they knock together. So you can see right here on the spine, this is knocking together. Unless we had a fracture, it can't actually get out of alignment. It can move too much or too little, that can cause problems. But right here at the SI joint, this is the bottom of the spine, the sacrum, this bone, and then this is the ilium. That makes up the pelvis. So we can have a forward rotation, a backward rotation, we can have an up slip, a down slip, or we can have an in flare or an out flare. So all of those things is probably the most complicated thing in our industry, and I hope I'm explaining it well. Please leave us a question or a comment so I can explain it better if I'm not. So, but this, being able to identify which direction it's going is important when you're working with somebody, but there's muscles that we need to work on to recreate balance. And that's really the issue that's happening. That this joint, when it's normal, when it's healthy, it moves 1 to 3 millimeters. So, and we can add a video on here so you can see how it's gliding. So when I walk this SI joint, it's moving. My pelvis moves on a stable spine. My spine's in the middle, and then the ilium's moving on it. And so when those muscles get out of balance, let me grab the muscles. right here, when these muscles get out of balance, so this is the front of the spine, the guts are cut away, and this is called the psoas major. And so this is our biggest hip flexor in the body, and when it gets tight, it can pull our back into extension and close down space for the nerves, but also when it gets really tight, it can pull us into that posterior rotation, so this backward rotation. And so each one, if we have a forward rotation or a backward rotation, it really changes how the leg feels, because the leg's going to be longer or shorter on one side, and we want to recreate that balance. With this model, you can see how many muscles, so this is that same muscle right here, the psoas major and iliacus are running right here on the front of this pelvis, and then these muscles, our sartorius and our rectus femoris, are the muscles running on the front of your quad. And so they're pulling on the pelvis. And then if we look at the back side, our glutes are pulling on the pelvis. And then what we're missing right here is actually on this model is our quadratus lumborum. This is pulling on the pelvis. So we have a lot of muscles. You're not gonna get a quiz. You don't have to learn all the names of those muscles, but you can see that it's like an X pattern of muscles that are holding that pelvis in place, and that imbalance is what causes us problems. So we have another video that we can link in the description where it's called lower cross syndrome, and that's what we see most commonly, is that our hip flexors are really tight. It's because we're sitting too much. We're really tight in this position, so our back extensors are tight as well. So these pair together, hip flexors and back extensors get really tight, and then our glutes don't fire really well, and then our abs don't fire really well. When that's happening, we end up having back pain, hip pain, even knee pain when we're having problems with lower cross syndrome. But 95% of the time to 99% of the time, we have an SI joint dysfunction, and that's what starts causing us to have a functional short leg, a long leg. So we want to dive into fixing that, and we fix it with muscle imbalances. Make sure you hit the subscribe button. Leave a comment if you have any questions. We want to make sure that this information makes sense to you so that you can get the help that you need from your own home. We'll see you in the next video.